Through the Come Care With Me program, a partnership between Iowa Caregivers Association and PHI, Iowa's elected officials are learning firsthand how important direct care workers are to Iowans. Iowa's Lieutenant Governor Kim Reynolds and others better understand how direct care workers touch the lives of older Iowans and persons with disabilities and their families, employers, our local communities, and economies. Many experts predict a tsunami of needs with the aging baby boomers. Iowa needs at least 10,000 new direct care workers over the next few years, but these workers are hard to find and keep. An investment in this vital sector of the health and long-term care workforce will help us to avoid a tsunami of unmet needs.
My role here at the Pender House would be to take care of Rachel. I help her with her daily activities, helping her to have social activities. Anything that she really wants to do or needs, I do for her, of course with the help of her mother and father.
Our patients typically have anything from disabilities to elderly. My oldest patient is 96 and my youngest is 14, so we do a range of services.
The average person doesn't realize the importance of the role that direct care workers provide in helping families live as normal a life as they can in their daily routine and the value that they provide to the family.
My patients are definitely part of my family.
Well, it was an amazing experience, and just to be able to come in and actually walk in the shoes of what a direct care worker actually does every day, and to talk not only with Rachel, but to be able to do what Emily does every day, and then to visit with the family and just see the impact that it has on their daily life and how important it is to everybody in the family. It's been really beneficial, but I really believe in that too, beneficial for me to be in it and be a part of it and actually experience it firsthand, because I think then it's easier to, when you're moving forward with the issues and talking about what needs to happen and what needs to take place, that you actually can understand some of what they're dealing, what our direct care workers are dealing with.
I would say affordable health care. You know, we take care of sick people. We are definitely exposed to a lot of germs and things like that, and to not have health insurance for yourself can definitely be very scary.
When you're making $8 to $9 an hour, you're having to pay for insurance. Well, pretty much your paycheck is going to benefits. And sometimes those benefits aren't always the best. I think our aides, you know, they're individuals, they're out in the field, they're working independently. They deserve to be paid more, and the average scale is, you know, $7.50 to $8.50 starting, and that you just can't make a living on that. And they are the primary caregivers.
My primary takeaway would be, I guess, how wonderful it is that we can keep these individuals in the home and that they have a home environment, and how important that is, I think, to Rachel. I mean, she gets to stay in a home and be a part of the family and go to family activities and go to school instead of being institutionalized. You know, I'm a mom and a grandma, and it was just really inspirational to see how she can, you know, be part of everyday life and really participate. And you could tell that she was excited to get on the bus and to start her day, and just so appreciative of a family that is there for her, and to make sure that she has all of that, all that normal activity that kids get to go through. It just was really neat to see her look down at me like I'm off for the day and ready to go, and I just thought that was pretty neat.
I just couldn't imagine our life without direct care workers. I think most certainly Rachel would probably be in have to live in an institution by now if we didn't have that support.
A lot of people need to understand that those direct care workers and home care aides are probably the most important in the field right now.
People need to recognize that doing this job is not as easy as they seem to think. Everyone thinks that somebody can walk in off the street and take care of somebody else. That's not true. You need to have the education, you need to have the experience, and right now there is a desperate need for those people. So if anyone has ever thought about doing this, please try it, help someone. Everyone needs someone.
And there's going to be a tremendous need for it. I think the numbers are going to do nothing but grow, and we need to make sure that we have workers available. So we need to make sure that we're working with them to meet their needs that will keep them involved in direct care work and helping out families.
If you care about Iowans receiving good care and support, contact the Iowa Caregivers Association to see how you can get involved.